Hi there, welcome to the Nova Scotia College of Nursing's webinar on documentation guidelines for nurses. I'm Jeline Simmons, a practice consultant here at NSCN, and I'll be joined by Jennifer Best, also a practice consultant here at NSCN. The Nova Scotia College of Nursing is legislated to serve and protect the public interest through the regulation of individual registered nurses, nurse practitioners, and licensed practical nurses in Nova Scotia. Only RNs, NPs, and LPNs and students of a nursing program can use the term nurse. Therefore, in this presentation and in the new documentation guidelines for nurses, the term nurse will refer to all three classes. Additional mandates of NSCN include preserving the integrity of the nursing profession, to set, monitor, and enforce the standards for the profession, and maintain the public's confidence in the ability of the nursing profession to regulate itself. What do we do as practice consultants at NSCN? We support nursing practice through development of print resources, so Q&A documents, practice guidelines, policy and position statements. We provide practice consultations in various ways through phone, email, site visits with individuals and groups. We provide education sessions on the standards of practice, social media, accountability, collaborative practice, professional presence, and documentation such as today.
What is nursing documentation? Perry Potter, Stockhart and Hall define documentation as a nursing action that produces a written and/or electronic account of pertinent client data, nursing clinical decisions and interventions, and the client's responses in a health record. Documentation is an integral part of professional nursing practice, and documentation is not optional but required. Documentation is not just a task that needs to be done to show that nursing care was done. Documentation is client care. What is a standard? A standard is a legal and professional basis for practice, a point of reference by which performance is measured, and it's a benchmark for assessing professional conduct regardless of specialty or practice setting. The standards of practice for both RNs and LPNs both address documentation. For the RNs, it's addressed in Standard 2, Knowledge-Based Practice and Competence. We state a registered nurse demonstrates this standard by appropriately documenting written or electronic, timely and comprehensive assessments, decisions about client status, plans of care, interventions, and outcomes. Appropriately is further defined as being clear, accurate, comprehensive, legible, chronological, and reflective of relevant observations. For the LPNs, we address documentation in Standard 1, Professional Accountability and Responsibility. LPNs are accountable for their practice and responsible for ensuring that their practice and conduct meet both the standards of the profession and the legislative requirement. Indicator 110 states that LPNs maintain documentation and reporting according to established legislation, regulation, laws, and employer policy.
Professional principles of documentation. There are 6 essential characteristics or elements that all nursing documentation should contain. They should be factual, objective, and client-centered. So descriptive and objective information that's based on first-hand knowledge, the nurse's assessment, and the client's perception of their needs. They should be accurate and relevant. Clear and easy to understand information containing sufficient details about the client's care and/or variances in the client's responses to care. They should be complete, including the nurse's actions and the client's responses, utilizing all of the components of the nursing process. They should be current. The information is up to date and it should be recorded during or as soon as possible after the intervention, education, or interaction occurred. They should be organized, logical, and sequential. So information that's gathered should be documented in a chronological manner so that nursing decisions, nursing actions, and the client responses to actions are evident. They should also be compliant with standards of practice and other legal requirements. The information reflects the delivery of safe, competent, ethical, and compassionate nursing care and is consistent with the standards of practice for RN Standard 2.6 and for LPN's Standard 1.10. Also the employer policies and provincial or federal legislation. Confidentiality. Clients have a right to privacy. Failure to protect that right can constitute professional misconduct. Storage of health records and technology does not change the client's right to privacy of their health information. Healthcare professionals should view the security of client documentation as a serious issue. Failure to comply with legislation, falsifying information, or providing information without the client or agency consent may constitute professional misconduct. Sharing confidential information is only acceptable in an effort to support the provision of quality care with the healthcare team members who are a part of the client's circle of care. Documentation in any format should be maintained in areas where the information cannot be easily accessed by casual observers or those not directly involved in the care of the client. Health records maintained in a client's home should be stored in a manner to reduce the risk of family members or others, visitors or guests, accessing confidential information. Agencies should have policies outlining who has access to the health records and how clients and their family members are made aware of the importance of maintaining this confidentiality. Technology does not change the client's right to privacy of their health information, and maintaining confidentiality, including storage, access, retrieval, and transmission of the client's health record, is essential regardless of which format.
So why do nurses document? There are several reasons which we're going to review. Communication amongst the healthcare team. Quality documentation supports the exchange of pertinent client information among the interprofessional care team. For continuity of care, all members of the care team require accurate information about clients to ensure the development of organized, comprehensive care plans. Inaccurate or incomplete documentation can lead to fragmented care, repetition of tasks, and delay or omissions of therapies. Professional accountability. Documentation is one way nursing knowledge, judgment, and skills are demonstrated. Nurses are expected to follow their professional standards and code of ethics. Legal reasons. A client's record is a legal document and can be used for evidence in a court of law or professional conduct proceeding. Courts may use the health record to reconstruct events, to establish dates and times, to refresh one's memory, and to substantiate and/or resolve conflicts in testimony. Quality assurance. Through chart reviews, audits, and documentation is used to evaluate the quality of services and appropriateness of care. Funding and resource management. The analysis of quality documentation supports the allocation of resources, workload measurement, and fiscal utilization. And finally, research. Data obtained from health records is used in health research to assess nursing interventions, to evaluate client outcomes, and determine the effectiveness and efficiency of care. Whose role is it to document? Legislation and the standards of practice require nurses to document the care they provide to demonstrate accountability for their actions and decisions. First-hand knowledge means the professional who documents is the same individual who provided the care. In situations where two or more people provided care or services, the nurse who has the primary assignment is expected to document the assessment, interventions, and client response, noting the role of the other care providers as necessary. However, the second provider is expected to review the documentation and make additional entries if necessary. There may be an occasion when a nurse realizes after their shift that they have left for the day and they did not document the care they provided. In these rare circumstances, another nurse, if requested, can document the information with the date, time, and designation of the person from which it was received in the client record as per agency policy. In emergency situations, such as a cardiac arrest, it may not be possible for the nurse providing care to document that care, and it would be acceptable to have a designated recorder. Agency policy should support the practice of designated recorders in these types of situations. In some settings, a client or family member may be permitted to document their observations and the care that they provide in the client record. Agency policy should outline this process for the client and their family members, as well as the documentation responsibilities of the nurses. Students are expected to document the care they provide in accordance with agency and academic policies. Co-signing notes written by students is not acceptable and may add an additional level of accountability for nurses. It may be necessary for the nurse who's acting as the preceptor to document their own assessment, intervention, and evaluations. This need for an extra level of documentation must be based on agency policy and professional judgment. Unregulated care providers should document the care they provide. If they are unable to document the care due to agency policy, nurses should advocate for change in this policy to ensure that nurses are able to meet their professional standards.
Self-employed nurses must adopt a documentation system and develop appropriate policies, including those related to the storage, retrieval, and retention of health records. NSCN has a practice guideline to support nurses who are self-employed. Knowing the difference between co-signing and countersigning? Co-signing refers to a second or confirming signature of a witnessed event or activity. Co-signing entries made by other care providers is not a standard of practice, and when poorly defined can blur accountability. If two nurses are involved in an assessment or the delivery of care, both should document according to agency policy. For example, if two nurses are required to hang a unit of packed cells and both must sign the health record, the intent of the co-signature should be clearly stated in the policy. In this case, agency policy would indicate that the co-signature is confirmation that the nurse, co-signing nurse, witnessed that the correct unit was given to the correct client. Co-signing implies shared accountability. Therefore, the person co-signing needs to witness or participate in the event. Countersigning, on the other hand, is defined as a second or confirming signature on a previously signed document that is not witnessed. This is not best practice and is generally not supported, but may be used as a quality control process. For example, in a 24-hour chart review, a nurse reviews a chart to determine if all of the orders are accurately transcribed or all required interventions have been completed. Countersigning does not imply that the second person provided the service, but it does imply that the person approved or verified that the service or record was completed. Agency policy and procedure should be in place to support this practice.
Nurses should record data collected through all aspects of the nursing process. As a general rule, any information that is clinically significant should be documented, such as the nursing assessment, nursing diagnosis, any planning, the implementation of nursing interventions, and the evaluation of those interventions. Effective client-focused documentation should include a plan of care. A plan of care is a written outline of care for individual clients and is part of the permanent record. For more information on the plan of care, see the NSCN Nursing Care Plan Practice Guidelines. Accurate and concise documentation on admission, transfer, transport, and discharge provides baseline data for planning subsequent care and follow-up. Agency policy should identify expectations on recording communication between practitioners when client care is transferred. Nursing documentation should include information on the client's status at discharge, any instructions provided, arrangements for follow-up care, and evidence of the client's understanding and the client's family involvement as appropriate. Nurses provide a wide range of client education on a daily basis. Accurate documentation of this education is essential to enable effective communication and continuity of what has been taught. The following aspects of client education should be documented in the health record: both formal and informal teaching, materials used to educate, the method of teaching, involvement of the client or the family, evaluation of teaching objectives with validation of client comprehension and learning, and any follow-up required. A serious reportable event or occurrence is an event which is not consistent with the routine expected care of a client or the standard procedures in place in a practice setting. Examples include patient falls, medication errors, needle stick injuries, or any circumstances which places clients or staff at risk of injury. Serious reportable events which involve clients are generally recorded in two places, in the client's medical record and an incident report, which is separate from the chart. The purpose of a health record and an incident report differ. Therefore, for the sake of clarification, the nurse should avoid documenting refer to incident report in the client's health record. Documentation of a serious reportable event in the chart should be recorded by the person who witnessed the event. The documentation should be accurate, concise, factual, unbiased, and not contain the words error, incident, or accident. The nurse should first document the incident in the health record to ensure continuity and completeness, and then complete an incident report in accordance with agency policies. Serious reportable event reports, which are also called occurrence reports, are separate from the client record and are used by agencies for risk management, to track trends, and to justify changes in a policy, procedure, or equipment. Information included in an occurrence report is similar to the information included in a client's health record. However, the incident report also includes additional information about the particular incident. For example, the door was broken, or this is the fourth such occurrence this week. And these things are not directly related to the care of the client. Agency policy should clearly describe processes necessary to complete an occurrence report. Agencies should have specific policies and procedures related to the documentation of medication administration. The general requirements for this type of documentation include the date, the actual time the medications were administered, the name of the medication, the route of the medication, the site of administration when appropriate, the dose delivered, the nurse's signature and designation. Each individual care provider should sign for the medications they administer, except in an emergency situation. In these situations, nurses may sign for medications administered by other health care providers as long as this is supported by agency policy. For additional information on medication administration, please see the Nova Scotia College of Nursing Medication Guidelines. Documentation in the health record begins with the date and time and ends with the recorder's signature and designation. Signatures and initials need to be identifiable and follow agency policy. Personal initials can only be used if a master list matching the caregiver's initials with the signature and designation is maintained in the health record. Agency policy needs to support the method in which date and time are documented. For example, is it a 24-hour clock or a 12-hour clock? And what is the consistent written format of the date? A consistent timepiece should be used when possible to record time, for example, a cardiac monitor. If you're unable to use the specific timepiece, your documentation should reflect what timepiece was used to record the time in case of inconsistencies.
When documenting for groups or communities, the documentation should provide a clear picture. If the client is receiving services from two or more agencies or departments that have separate records, for example, health and justice, it is important that the nurse follows agency policy and records the care they provide in all relevant documents. The needs or goals of the groups, the nurse's actions based on the needs assessment, the outcomes and evaluations of those groups. All must be recorded. Information about individual clients within the group may be recorded in the individual client's record. Agency policy will direct where this information is recorded. If the client is receiving services from two or more agencies or departments that have separate records, for example, health and justice, it is important that the nurse follows agency policy and records the care they provided in all relevant documents. There is an increasing number of healthcare professionals that are using mobile devices to communicate prescriber orders by text message or email. This type of communication is discouraged due to the risk of violation of confidential health information and incomplete communication of client status. Unauthorized disclosure of clients' personal health information is a risk because mobile devices can store and retain data on the device itself. Also, mobile devices are vulnerable to loss and theft because of their small size and portability. Encryption and the use of strong passwords are the most effective way to safeguard a client's personal health information. Without encryption, any emails, voicemails, pictures, or texts could be inappropriately accessed or disclosed if the mobile device is lost, stolen, or inadvertently viewed by another person. Vital information related to the context of the client assessment may be lost when using a text or email to communicate that information. Text can be subject to interpretation and lead to inappropriate, incomplete, or insufficient prescriber orders. Text or email should not be used for provider convenience. However, if text or email communication is the only way health professionals can communicate in the best interest of the client, agencies must have clear policies to support this practice. Policies and protocols and systems should enable healthcare practitioners to use secured wireless devices to interact with each other and to access client records.
Interdisciplinary communication and documentation supports interdisciplinary practice and can eliminate duplication, enhance efficient use of time, and enrich client outcomes. Collaborative documentation enables healthcare professionals of all disciplines to share the same documentation tools. Examples of such tools are clinical pathways and integrated to interdisciplinary client progress notes. Nurses need to ensure that their documentation within an interprofessional tool accurately reflects the unique contribution of nursing to the care of clients. When nurses collaborate with members of the interdisciplinary team to develop or modify the plan of care, they should document the following: the date and time of the contact, the name of the people involved in the collaboration, information provided to or by healthcare providers, responses from healthcare providers, the orders or interventions resulting from the collaboration, the agreed upon plan of action, and any anticipated outcomes. For example, if a nurse seeks clarification from a physiotherapist related to mobilization of a client, the nurse should record the reason for seeking clarification, the name of the healthcare provider responsible for the clarification, the action they took, and the expected outcome. Objective information deals with facts or conditions as perceived without distortion by personal feelings, prejudice, or interpretations. Objective data is observed or measured and includes interventions, actions, or procedures, as well as the client's responses. Subjective data is modified or affected by personal views, experiences, or background. And subjective data may include information provided by a client as well as the client's family members or a friend. Documentation should include objective statements related to the nursing process. At times, it may be necessary to include subjective statements in the documentation to enhance the understanding of the client's care. Subjective information should provide accurate examples of what was said using quotes appropriately, along with identification of the individual who made the statement. For example, client states, "I am pain-free today," or "I understood the information provided." You should avoid generalizations in your documentation, or vague phrases or expressions. For example, status unchanged, assessment done, had a good day, slept well, or up and about. Such vague statements are conclusions without supportive facts. Be specific. Use complete, precise descriptions of care. The use of words such as appears, seems, or apparently are not acceptable when used without supporting factual information because they lacked certainty. Only document conclusions that can be supported by data and avoid value judgments or unfounded conclusions. Select neutral terminology when describing observed behaviors. For example, rather than stating the client was drunk, it would be correct to state, "Noted an odor of alcohol and speech was slurred." Instead of noting client is aggressive, it would be correct to state the client has been shouting and using obscene language. Nurses have an ethical responsibility to respect a client's informed choice, even if those choices may be risky to the client's overall health. The nurse must document the objective data related to risk-taking behavior and avoid placing a value judgment on the behavior. The nurse should also document information they provide to the client about the risk-taking behavior and any potential consequences of the behavior. It is not acceptable to document the client as non-compliant. Instead, the nurse should document the objective data and describe this behavior. If the risk-taking behavior results in a situation in which mandatory reporting must occur, the nurse is required to follow legislation and document appropriately. Inaccurate documentation can result in inappropriate care decisions and client injury. Errors must be corrected according to agency policy. The content in question must remain clearly visible or retrievable so the purpose and content of the correction is clearly understood. If an error occurs in paper-based documentation, do not make entries between lines, do not remove anything, for example, monitor strips or reports, do not erase or use correction products, stickers, or felt pens to hide or obliterate an error. A generally acceptable practice is to correct an error in a paper-based system by crossing out the word with a single line. Above the line, write mistaken entry and insert your initials, along with the date, time the correction was made, and enter the correct information. To protect the integrity of the health record, changes or additions need to be carefully documented. Never remove chart pages. Entries should not be recopied or removed because of a documentation error. Failing to correct an error appropriately, according to your agency policy, or modifying another's documentation could be interpreted as falsification of a record. Falsification of records is considered professional misconduct.
Correct spelling and legibility of nursing documentation demonstrates attention to detail and nursing competence. Misspelled words or indecipherable entries can result in misinterpretation of information, which could result in client harm. Spelling errors and mixing up the names of certain medications can cause serious treatment errors. All entries in paper-based systems should be written legibly in accordance with agency policy related to the type and color of writing instrument and the color of paper used. Blank or white space in paper-based documents should be avoided, as this presents an opportunity for others to add information unknown to the original author. An accepted practice is to draw a single line completely through the white space, including before and after your signature. Fill in all blocks or spaces on flow sheets with the agency-approved symbol or comment. The use of abbreviations, symbols, or acronyms can be an efficient form of documentation if their meaning is well understood. Abbreviations and symbols that are obscure, obsolete, poorly defined, or have multiple meanings can lead to errors. Use only those abbreviations, symbols, and acronyms on a current agency-approved list. You can also view on the Institute of Self-Medication Practices a list of current abbreviations, symbols, and acronyms. In Nova Scotia now, many agencies have moved toward electronic means of providing many aspects of care. Electronic documentation is now part of the everyday care of many clients. This could include entering requests for tests and consultations, reporting diagnostic testing, or documenting care that's been provided. A client's electronic health record is a collection of the personal health information of a single individual entered or accepted by healthcare providers or stored electronically under strict security. As with traditional paper-based systems, documentation in an electronic health record must be comprehensive, accurate, timely, and clearly identifies who has provided what care. Entries are made by the nurse that's providing the care and not by other staff. Entries made and stored in an electronic health record are considered a permanent part of that record and may not be deleted. Client information transmitted electronically must be stored either electronically or in hard copy, and if relevant, may be subject to disclosure in legal proceedings. Agencies need to have clear policies and guidelines to address these challenges and other issues related to documentation in electronic health records. Nurses must advocate for agency policies and guidelines that reflect and support quality, evidence-based practice. Agency policies related to electronic documentation should clearly articulate how to correct documentation errors or make late entries, to prevent the deletion of information, how to identify changes and updates in the health record, how to protect the confidentiality of the client information, how to maintain the security of the system, for example, regularly changing passwords, issuing access cards, virus protection, encryption, and well-maintained firewalls. How to track unauthorized access to clients' information, and to use a mixture of electronic and paper-based methods as appropriate. Policies should ensure the continuity of care that is being maintained. How to back up client information, how to document in the event of a system failure, and how to obtain access to a specific group or area of information.
Fax transmission of client information between healthcare providers is convenient and efficient. In spite of this, there's still risks to the confidentiality and security of information transmitted via fax due to the possibility of transmitting to unintended recipients. Agency policies should guide nurses in the acceptance and transmission of faxes for the purposes of client care. The confidentiality and the security of client information via fax can be enhanced by the location of your fax machine, stored in areas away from public access, which should decrease the likelihood of an unattended breach of client confidentiality. Make a reasonable effort to ensure that the fax will be retrieved immediately by the intended recipient or will be stored in an area that is secure until it can be collected. Shred any discarded fax information containing client identification. Carefully check activity reports to confirm successful transmission. This ensures the fax was sent and is not sitting in the queue to be resent or accessed by somebody else. Include a cover sheet with a confidentiality statement that identifies the fax document as confidential and instructs unintended recipients to immediately destroy this document without reading it. This is a safeguard to make the unintended recipient accountable for any actions they may take with information incorrectly sent for them. Advocate for secure and confidential fax transmission systems and policies. This is an important leadership action that contributes to quality practice environments. The use of email transmission by healthcare agencies and healthcare professionals is becoming more widespread because of its speed, reliability, convenience, and low costs. However, like faxes, there is a significant risk to the security and confidentiality of email messaging. Messages can be inadvertently read by an unintended recipient, and while the message can be erased from the local computer, they are never deleted from the central server and could be retrieved by an unauthorized personnel. This is not recommended as a method for transmitting client information. If your agency does decide that they want to use email transmission, there's some things you should keep in mind. Client consent should be obtained before transferring any information by email as dictated by your policy. Even with significant safeguards, transmitting information by email has a higher risk, and the client should be informed about that risk and the process. Transmit email using special security software, for example, encryption, user identification, or secure point-to-point connections. Encryption safeguards against hacking and unauthorized personnel from accessing client information. Never allow anyone else to access your password for an email. Sharing passwords is a risk-prone activity because it allows others to access client information under your name. Nurses that share their passwords or do not take reasonable steps to protect their passwords may be held accountable for any activity that occurred under their name. Check the email address of the intended recipient and ensure it's correct prior to sending. Ensure the transmission and receipt of email is to this unique email address. Maintain confidentiality of all information, including that is reproduced in hard copy. You should locate printers in secure areas away from public access and retrieve printed information immediately. This decreases the likelihood of an unintended breach of client confidentiality. Emails should include a confidentiality warning indicating that the information is being sent confidential and that the message is only to be read by the intended recipient and must not be copied or forwarded to anyone else. This is a safeguard that makes the unintended recipient accountable for any actions they may take with information incorrectly sent to them. Never forward an email received about a client without the client's written consent. The client must grant permission for the information to be shared with others. Advocate for secure and confidential email systems and policies. This is an important leadership action that will contribute to professional environments.
Giving telephone advice is not a new role for nurses. What is new is the growing number of people accessing telephone helplines to assist their decision-making about how and when to use healthcare services. Agencies such as health units, hospitals, and clinics increasingly use telephone advice as an efficient, responsive, and cost-effective way to support self-care or to provide health services. Telenursing is subject to the same principles of client confidentiality as all other types of nursing care. Nurses that provide telephone care are required to document the telephone interaction. Documentation may occur in written form, in a logbook or client record, or via computer. Minimum documentation includes the following: date and time of the incoming call, including voicemail messages, name, telephone number, and age of the caller if relevant, and when anonymity is important, this information could be excluded, the reason for the call, assessment findings, signs and symptoms described, specific protocol or decision tree used to manage the call where applicable, advice or information giving, any referrals made, agreement on the next steps for the client, and required follow-up. For further information on telenursing, see the Telenursing Practice Guidelines on the NSCN website. Documentation should occur as close as possible to the time of care to enhance credibility and accuracy of the healthcare record. Documentation should never be completed before care or an intervention has taken place. Documenting events in the chronological order is important, particularly in terms of revealing changing patterns in the client's health status. Documenting chronologically also enhances the clarity of communication regarding the care provided, the assessment data, and the outcomes or evaluations of that particular care, including the client responses. The frequency and amount of detail required in documentation is generally dictated by a number of factors, including agency policy and procedure, complexity of a client's health problems, the degree to which the client's condition puts the client at risk, the degree of risk involved in a treatment or a component of care. While agency policies on documentation should be followed to maintain a reasonable and prudent standard of documentation, nursing documentation should be more comprehensive, in-depth, and more frequent if a client is very ill, very unpredictable, or exposed to high risk.
Documentation should occur as soon as possible after an event has occurred. When this is not possible to document at the time of or immediately following an event, or if extensive time has elapsed, a late entry would be required. Late entries or corrections incorporating omitted information in a health record should be made only when a nurse can accurately recall the event or the care provided. Late entries must be clearly identified, individually dated, and follow agency policy. They should reference the actual time recorded as well as the time when the care or the event occurred and must be signed by the nurse involved. If extensive time has elapsed between the care and the documentation entry, seek guidance from your employer before you add your notes. That brings us to the end of this webinar. If you have any questions about this topic or any other professional practice topic, you can reach us at practice@nscn.ca or call 1-833-267-6726 and ask for a practice consultant.